Opinions expressed on this program do not necessarily reflect those of the advertisers, owners, or management of Pacific Telestations, LLC. For comments, opinions, and questions, please email Jess Lujan at jessthebuzz@gmail.com. The Buzz with Jess Lujan.
Good evening, I'm Jess Lujan. Welcome to episode 2 of The Buzz with Mayor Rhodes. Asked to come back again to continue our conversation from last week on Bill 359-33. Again, that the industry, and reading it, looks like it targets one industry in general to provide health insurance that they already do to their employees. Mary, good evening again. Thank you for coming back.
Have a day. Thank you again for having me.
Yeah, you know, last week in our conversation, of course, 359-33, there's a misconception that the industry does not already provide health insurance and benefits, health insurance benefits to its employees. And I'm saying, well, you're going to mandate this for an industry. And if you look at GovGuam, is there an existing mandate that all GovGuam employees have to have health insurance? And I'm looking at this, and you know, the government, we're tackling this problem. You were in the health industry, health insurance industry for quite a number of years, and you know this more than I do. And the government side, I know we've been tackling this since ever since. GovGuam, in what we pay, we lump all of GovGuam into one bucket, basically. So you have very well patients, you have not so well patients, you have very sick patients, all in this one bowl. No, you know, you don't have separate entities here. So as a result, basically, you're paying the premium that's combined of all this. We don't have newer employees coming in all the time, younger and maybe very well. I mean, you know, they're not sick, not having to use or again utilize their insurance. So we have a community, we have a GovGuam agency that uses the hospital and doctors a lot, and long term we're living longer. So it's really taxing not only the employer but the government of Guam a lot of money for this. So we've been trying to carve out the retirees to try to get them in a different plan. It hasn't happened since. Don't you think they should be working on this, and so, from someone who's been in the industry?
Well, I think Guam in general, the health insurance market has grown over the years, and you have 4 really, you know, large competing companies that are locally owned and locally managed. We used to have a lot of national plans, but because Guam is considered a small market, and you know, we're separate from mainland U.S., so you don't have a lot of national carriers really interested in coming to this market to help offset. Because the way insurance works is you have to have a larger pool of people, and so what you're really addressing is the GovGuam mix of employees and retirees and dependents. And you're right, we've had a retiree population that continues to age, even not just the retiree population, but even the actives. A lot of the employees are going to be, you know, retiring out, and you look at the old GovGuam plan, even the plan itself has changed. The contribution rates are different, the 401k programs are different, and so it just comes down to a matter of money, and GovGuam just doesn't really have that much to contribute towards that plan. So they continue to negotiate each year to negotiate the best rates. And that's what Bill 359-33 you know, kind of misses, is the fact that to require one industry that continues to provide excellent coverage, the contribution rates are there to cover the full-time employees. But GovGuam is the largest employer on the island and doesn't even provide what this bill is looking to mandate, which is full coverage of both the employee with all their dependents, and so it just doesn't exist. With the retiring population, that just goes back to, again, the hospital. You look at the type of care that is needed in that type of, in that population, and look at the number of specialists that we have. So now we have a private hospital, and I think that the private hospital itself, probably has seen its challenges since they first opened their doors, in the type of diseases and chronic care that's exists in our island. And so those types of medical diagnoses and specializations require a certain number of even types of employees that we may or may not have readily available in Guam. So it all attributes to the cost of healthcare, which is what helps, is one of the main reasons why health insurance rise. So with Bill 359, if they are going to address Affordable Care Act, and we already have the mandates, like I said earlier in the previous show. We have all the mandates, but we don't have the subsidies. So what is that going to look like? I'll tell you now. When they were looking at participating in the Affordable Care Act, a lot of the insurance companies went out and they talked about this with both GovGuam as well as the private sector companies, that at the end of the day, if all of the benefits increase and you get this premium type of package, the insurance premiums are also going to increase. And so the government of Guam needs to really look at if they are going to introduce any kind of universal health care plan, or anytime they address these issues, they can't further burden private sector to subsidize that. It is not the responsibility of private sector to subsidize those premiums. GovGuam needs to identify what those programs will look like, what existing programs and monies are available to help subsidize that, because that's the only way you're going to address the uninsured market. Because you're going to need programs like that.
Well, and again, you have to look at this holistically. Why is this problem a problem? Why did this exist? And it really existed, it really started since its inception from the very beginning, because the hospital, again, care of the hospital is not dependent on again, your ability to pay. Okay, you go there, whether you're very rich or you're very poor, it doesn't matter, okay? It's not dependent, your care of the hospital is not dependent on your wallet size.
Right.
Or if you even have a wallet at all, okay? It's not dependent on that. So you have a mandate, you basically have a free institution, basically. So in order to change that, you have to change this mandate. You can't tell me you can't change it. We have changed the Organic Act. We have amended the Organic Act over the years. We never used to have our elected governor. Now we do through Organic Act amendment and changing of that. When we were not satisfied by a governor choosing the Board of Education, we went and amended that. Now it's the government, which is us, the people, chooses that. Elected Attorney General, okay, that used to be an appointed. We did that through Organic Act. So we have a couple other things. Again, the Supreme Court, the courts of Guam are now are now one united court. It started off with a bill, which I was a part of, to consolidate the court as one. But we went back, and it changed again the Organic Act and made it one consolidated court. So we don't have two courts now, one consolidated. So we have changed it over the years. So again, if you want to solve that problem, go back to your maker and see who you are and what they made you to be, and kind of change that, because you are not made to make money. And then to blame this, and the hospital existed really before GHRA existed, before the inception of that. So you need to go back to the very beginning, and change that, and don't blame all the other industries. One of the things I looked at in QCs, people have a problem with QCs. I don't have a problem with QCs. Over the years, yes, it has been watered down. We agree that things they should probably revisit what QCs are all about. When I'm looking at the hospital, the new hospital that got a QC, I'm in favor of a QC, but in requiring the new hospital, to acquire, I think, $1 million in art, and I'm going, maybe for a hotelier, that maybe, but for a hospital, I said, requiring them to buy $1 million in art, wait a minute. Can we do something else? Can we revisit that? And don't be one size fits all, because this industry needs. I mean, we could do a lot better with $1 million rather than buying art. And we know what our shortcomings are in healthcare. Can we do something better than that? Our senators need to revisit some of these things that exist and say, hey,
Right.
is this applicable to that or in this industry? Let's tweak it. It can't always be legislation that one size fits all.
Yeah, definitely. I think just the structure of GMH and I think that they've been challenged for a very, very long time. There have challenges even in underfunding with, the government programs that are locally funded, like MIP and the medically indigent program, as well as Medicaid. So it's not just its structure; it's the way it bills out. Are they up to date with their coding and their billings, and how fast are they getting received from Medicare? There are a lot of issues that plague the hospital because they continue to service the entire market. If you look at our neighboring islands and the challenges that they have as well, GMH has those same problems. And some hospitals around us have sliding scales for the different types of populations and their socioeconomic status. We knew this was going to happen. I actually served on the board that looked at the private hospital foundation that actually looked at that type of funding, and there were a lot of discussions even before the hospital even had a name. Even GMH has looked at private hospitals coming in to possibly buy it out from the government and become privatized, like what we did with telecom with GTA. So there are a lot of opportunities out there to have these discussions and to address the issues more directly. And that's the challenge, is we have to have the direct conversation that really goes to the heart of the problems of why GMH
we have to have that
is
conversation,
struggling.
because that's the reality, and to continue to bury our head in the sand and say it doesn't exist because I don't see it or something.
Right.
We see it. I got to take a quick break. Okay.
Okay.
Be